I always walk into a room, no matter what room I'm going into or what situation, and I always think, how would I want my family members to be treated? If this was my mom or my dad, how would I want the nurse that's taking care of them to handle the situation? And I always keep that in the back of my mind every time I go into a room. In the ICU, we do run into situations where we do deal a lot with end-of-life care. And you do have your patients that are afraid, so, you know, it can be just holding a hand, letting them know, you know, that I'm here with you no matter what, saying a prayer, being just with them. And it's also taking care of those family members too, because they're also in a situation they may have never been in before. And you want to make sure that we're helping them through that.
You just have to have the compassion for what you do for the patients and the families, and know that even though you're behind the scenes, that you're still making a difference for them.
And you would think in a small community that there would be a huge support system for most all of our elderly, but there's not. There's so many that just go home alone and have no help. So that's my job, to make sure they get the help they need.
I think the lab, from our phlebotomist to our technologist to our director, you know, every day this is someone's mother, this is someone's, but it really hits home when you have somebody in the hospital and you think, okay, they're in there doing my mom's lab work. I hope they're thinking of her like I think of our patients when they're here.
We take care of 88 residents, the hospital, as full or empty as it is, all staff, and the public. And we monitor the diets on a daily basis, each meal. We have a person checking each tray to make sure that we follow through with their diets. But it takes every person in our department working as a team to take care of this many people, this many times a day, and try to get all positive feedback.
From the people who cut the grass outside to make it look as beautiful as it is, to the person that's starting your IV, or the one that's setting up home health. None of it would be possible without every member of the team.
I've worked several different hospitals, small ones, big ones, and probably this hospital is the most team-oriented hospital that I've worked at.
It's like one big family. You don't have to tell, you go do this, you go do that. Everybody already know their place, they know what to do, and know how to handle the situation when it comes down to it.
We make sure that the bed is properly working, the lights is properly working, the TV works. You know, that TV is important. Housekeeping, we do our best to keep their machinery running, the vacuums and the floor buffers, and keep it running so they can work. The dietary department, they got to be able to cook. So we do a lot of things to keep other people able to work.
Our role here is to serve the community. We want to help make sure that the overall health of our community is at its best, because these are our friends and our family members. Regardless of if I'm providing direct patient care, or if I'm your case manager helping to you to manage your health, or I'm someone in health information management who's going to give you access to your health record. It's this idea of accountability. We do own the care of the community. You know, people might not realize that our hospital is rated #1 in patient satisfaction. That is not an opinion, it is fact.
We treat every patient or resident just like their friends and family, and it's easy because they are. My 93-year-old grandmother is a resident at Twin Oaks. So when I say you're in my care, I am literally waiting on my granny, and I'm going to treat yours the same way I treat mine.
Our motto when marketing is providing quality health care for all of Southeast Georgia. So many people have said we're like a family here, and we are. But it's not just this community, it's everyone in the surrounding communities that come here.
It's not something that you can take lightly. Whenever you take a position in healthcare, it never closes. People are sick every hour of every day of every week. So you just have to accept those things and build a life around it.
We are expanding. We want to be able to provide different services for patients in this community to keep our hospital active where they don't have to go outside of our county, which is very important. Patients can actually just come into the office, get pretty much anything they need done there so they don't have to go to different locations.
At the clinic, I am responsible for my patients' care. I want healthy patients, healthy citizens here in Alma-Bacon and surrounding counties. There's nothing like working in your hometown and providing care to your community and helping people out, making them feel better and function and have a good, happy life.
This is my hometown, and so I take that very seriously, and it's really not just something that we say here, it's what we do and how we treat people. And we want them to feel like they are in our care from the moment they step into our office or the moment we step in their room until the time that they leave, because we just want them to feel safe and secure and like they're getting the best care possible.
The best. That's what we always try to be. You know, that's one of our goals, one of our aims. We want to stand out above and beyond any other hospital. You know, I know we're already in competition, so our job is to do what's best.